We apologize for the last minute update on the invite, but we will go ahead and get started. Again, I'm Kevin Gregory with the Health Action Council. I'm the Vice President of Business Development and Business Solutions here. And I'm going to go through our agenda for the day. And we're going to talk about what's going on. And the agenda for today is really behavioral health care needs. And we're going to bring in Heather Hardy from Optum to talk about what's going on there and talk about some of the resources that Health Action Council has been working on. So one of the things, Health Action Council is a member-driven organization, and a member to us is an employer plan sponsor. So when we surveyed our members this year, we asked them to rank the key issues about behavioral health. And as we were going through that, you'll start to see here, telehealth, emotional well-being, depression, resiliency, drugs, and alcohol. These are all key issues as a result of all of the transition that has gone on this year from being, working really well and on a regular basis, and then to being into a shutdown and kind of dealing with coming back to work, and then the ups and downs of kind of dealing with those issues. We're going to go through today. I'm going to ask everybody, if you wouldn't mind, to jump into your chat box and start asking some of these questions, right? So what are the types of behavioral health services your employees have requested? So we've got one from mindfulness, counseling. Other thoughts on, please, again, jump into your chat box. For those of you who are, maybe newer to Zoom, it can be under the more side of things. Self-care, got some more mindfulness coming in. Meditation, I like that a lot. Excellent. As we think about, in addition to that, have you seen an increase in behavioral health services at your organization this year? Seen a lot of yeses. That seems to be, oh, everyone who has teens. There you go. That's for sure. Thank you. And we have one no. So we have one outlier, which is always good. You never know when you're kind of starting this process. And I do tend to agree with that. That is a little odd. But yeah, most everything is yeses on that. Next question as we're talking about that is, do you believe there are enough available mental health providers to help? We got some no's coming in. Long waits. Got a one a yes. Not sure. Not sure. Maybe. Yeah, I think that's fair. I think as we're in dealing with that and kind of going from there, it's hard to get to the telehealth side of things. Yep, I think that those are all fair challenges. Dealing with telehealth for kids, absolutely. Those are going to be big challenges. And then lastly, is there anything specifically that your organization that you may need help with as it relates to behavioral health? Knowing how to find quality health, mental health providers, excellent. What other plans are offering? What can I do to help our employees? Experts to give everyone good virtual presentation for our employees. Something more than just promoting an EAP. That's excellent input there. Yeah, so as we go through and we're thinking about that, I wanted to take just a brief second. I want to thank everybody for doing that. We like to be, Health Action Council. We like to have action is in the middle of our name, so we have a lot of interactive features. How do we combat staff burnout? That's for sure. But I think today what I want to do, that's my real pleasure to introduce Heather Hardy from Optum. And she is a CHC. She's a Vice President of Behavioral Health Solutions from Optum. Prior to joining Optum, Heather worked across the health continuum from corporate wellness to an integrated primary care practice in a hospital setting. where she was charged with supporting patients through holistic lifestyle, behavior change programs while managing chronic disease, comorbidity, and behavioral health needs. So she's definitely an expert for this crowd and helping everybody out. At Optum, Heather works with employers to understand their behavioral health needs and identify solutions that will achieve their goals. So Heather, I will ask you to unmute, and then I'm more than happy to drive for you. Just let me know when you want to get started.
Fantastic, thank you. Is little.
You still there, Heather?
Yeah, can you guys hear me all right?
Yep, now we can.
Okay, I think I have it. It's nothing to help your mental health and well-being other than technology glitches when you're getting ready to have a meeting, right? So thank you for having me here today, and thank you for taking this time to spend and think about mental health. I thought it might be a nice way to sort of start our time together to practice a little bit about what we're going to be talking about. And I heard in the opening questions that there are a lot of interest in mindfulness, and certainly COVID-19, the pandemic, the year of 2020, without a doubt, has presented a real opportunity for all of us to use mindfulness and mindfulness-based practices as we go through our day-to-day operations in this new normal. So before we begin, I just would like to invite all of us to kind of sit back in your chair, right? Sit back in your chair, let your shoulders relax, kind of that tension that exists between our shoulders and our ears, let that just relax a little bit. If you're able to, uncross your legs, put your feet on the floor, put your hands down on your belly, and just take a really deep inhalation in through the nose. Deep breath in, feel your belly expanding until it's full. Kind of hold that there for a brief second, take in one more sip of air, and then long, deep exhale, and just let it all relax. As we start our conversation today, I'd like to invite you, if you would like to join me in setting an intention for today. We already kind of paved the way with the chat questions at the top of the call for that, but really set your intention. What is it about mental health and behavioral health that you're hoping to come away with at the end of the day today? And I'm going to circle back to these intentions at the end of our conversation to make sure that if there's any questions that you want to ask, you can come back to that intention and ask them, and also to kind of keep us grounded in why we're here today. Certainly, this new normal, this new paradigm that we're in is complex. New environments, new work routines, new office mates. As we speak, I'm sharing the office with my high school senior who's downstairs on her own Zoom meeting, working towards her class work as well, right? All of these new work environments, managing our teams from afar, staying connected with colleagues and figuring out new ways to drive that culture and have that water cooler chat in a virtual environment. We're seeing people struggling with financial issues, no doubt the unemployment rates, the stresses on families, childcare and elder care. Many of us are in this sandwich generation. We have younger or older children, as well as older and aging parents. And how do we help protect them and keep them safe? And then you have this interesting scenario where we have a pandemic. We have a virus, a highly communicable virus, that in order to keep ourselves safe from it, we need to stay away from people. Well, with that isolation, there's secondary effects. It can be lonely, or it can be too crowded. It can lead to feelings of sadness, loneliness, and depression. And we're certainly seeing a rise in that. Conversely, when we look at the future, we don't know. We don't have a time-bound answer for when our vaccination protocols will be delivered. We don't have a time-bound answer for when we're going to have all of the therapies in place to reduce all of the death and the hospitalization. And that creates anxiety, right? As we look forward into the unknown and we don't know, that creates anxiety. So we have depression and we have anxiety. And then unfortunately, what we're seeing a tremendous rise in with this is a rise in self-medication and substance use disorder. Statistically, last year, well, it's still 2020, I'm sorry, in March of this year, we saw alcohol sales increase 50%. We are unfortunately seeing a resurgence in the substance use disorder and around opioid use and addiction, as well as around alcohol abuse and misuse. And then last of all, and quite tragically, suicide is on the rise. So there's a lot going on in that mental health and that mental well-being continuum. And the pandemic has really been a catalyst to stir up a lot of these unfortunate responses. So let's talk about what we know and let's talk about what's happening. So if you go on to the next slide, this is a look at how people have been seeking care. So this is some Google Trends data. This is an analysis of, again, where and how people are seeking their mental health care. And if you look here, the red lines is, the red graph, if you will, is looking at the Google search for mental health services near me. The blue graph is looking at virtual mental health services. We've been predicting and we've believed in the behavioral health space for a while that virtual enablement would be a key strategy to answer some of that provider access that was mentioned earlier in the chat. And also that it is a really great way to enable connection and enable services in this space. However, if you look at that data, it hadn't quite taken off until, of course, the first half of 2020. And we saw a tremendous growth in people looking for and accessing virtual care. And so let's look on to the next slide as well. And again, you know, here at United and Optum, we have been laying that foundation. We've laid that foundation for virtual enablement. We've really built not just the foundation, but the whole framework, if you will, using a building metaphor. As there had also been a lot of investment in that digital behavior health venture funding. But again, if you look at 2020, this disruption with the pandemic, in 2020, the first half of the year alone, we've seen as much investment in virtual behavioral health funding as we were seeing in the prior 2 years. And again, we anticipate that that is only going to increase as it goes. So pop on to the next slide, please. So what does this mean, right? What is the path forward in behavioral health? What are we doing? What are we doing for you? And what can employers do? Here at United Behavioral Health, we are really laser focused on creating a complete ecosystem focused on member engagement, again, solving that problem. How do people get into the system? How do people connect with the right provider at the right time? But also, we're looking at provider enablement. Very often in that outpatient provider space, you have independent contractors. These are people who are individual providers. They have an outpatient talk therapy practice. And historically, it has been a little bit difficult potentially to engage with a network in a network system. And it's a burden, right? It's cumbersome. It's an additional thing to do. And we've really worked hard to enable providers, not only to make it easy for them to do business with us and provide great quality care to our members, but also as the virtual capabilities have come in, how can we help providers with these tools that we know make better experiences for members, they improve access, and they make the provider's experience. And this all then drives to that clinical value, really making sure that we get the right care for the right patient, the right member at the right time and at the right value. So this is sort of how we have, again, been looking at the path forward. So we can hop on to the next slide, please, if you would. Thank you so much. So how can we help employees connect to care safely? You know, this has really been tremendous. It has been a tremendous response from employers in terms of this disruption. And how do you connect your employees? We know that as team leaders, as employers, we care, we worry, we want our employees. We know that happy, well-engaged employees are more productive, they're healthier, they're happier. So how can we engage employees? An employee assistance program is a great, very quick and easily accessible tool. Again, within our employee assistance program, the providers, those outpatient providers are also inclusive of the network, which again, that is a great way to have seamless care if someone deploys their EAP benefit, but then wishes to continue and move their care under their benefit plan. The digital tools. I can't say enough about digital tools. I think back, oh, is there a question? No. I think back to about 5 years ago. I was at a conference and Dr. Oz happened to be the keynote speaker. And this sticks in my memory because he invited the audience he invited everyone to take out their personal health device. And I paused. I was a little confused at what he was asking for. I didn't have any, I wasn't currently carrying a glucose monitor or a blood pressure monitor. I didn't know what type of personal health device he was speaking to. But then of course, he held up the phone. These digital tools that are available through applications come through, it is something in your employee's pocket that can be a mindful resource. There are cognitive behavioral therapy solutions in the digital space, like Sanvello, which is one that we have as part of our plan. These are things that are in the pocket. They're where the person is. And we've heard a lot of wonderful stories from members tangentially about, oh, I had that app, it really helped me. I started meditating daily and I felt better. I listened to these different learning sessions through this, and they were able to help me get myself back into the game, if you will. And one of the things about virtual and digital tools, in behavioral health, when we think about our physical health, we know if we have an ache or a pain, or let's say our pants start getting a little bit too tight, that's a sign, right? Kind of like the check engine light in your car that says, oh, I better do something a little different here, right? We don't really have that ingrained in our mental well-being quite the same way. If you go out to a playground, which unfortunately we aren't going out to many right now, but if you're at a playground and you see a toddler trip, what's the first thing they're likely to do? Jump up, oh, mom, I have a boo-boo, can I get a Band-Aid, right? It's very ingrained in our self-care that we take care of our physical selves. As our mental health and our mental well-being gets challenged, we don't quite have those same reflexes. And a lot of a digital tool can be a place to go. It can be an evidence-based place to check in. It can serve as reminders. I know I get my reminder from my Sanvello app every evening, actually around 5:30 to check in. How was the day? Okay, this is my signal for me that I'm departing from my work day into my home day, even though it's all happening under the same roof all day, right? Virtual visits. Again, the virtual visit enablement was pretty amazing, candidly, when people went home. Again, here at United, we built that foundation, we had that framework, and we were able to turn everything on very quickly as an accelerant. And we've expanded our network, and it's continuing to expand daily, over 10,000 virtual visit behavioral health therapy providers. And then with that has come a next level of virtual therapy solutions, not just outpatient talk therapy, but there's some medication-assisted therapy programs, there's some intensive outpatient programs, and things to address some of those higher acuity mental health conditions like substance use disorder. And the next slide, please. And then the feedback and the measurement. I am a big believer in measurement. We have to not just turn on everything, but we have to turn it on and measure it, and we have to measure it for success. We have to measure it for efficacy. We have to measure it for member satisfaction, and we need to make sure that we're achieving those clinical value goals that we want. And again, it has been very well appreciated and very well received by members to have the ability to engage in their virtual care. And I think what we're noticing is that there's a likelihood that this will continue post-pandemic. The ability to use a virtual visit, we're seeing that likelihood is increasing, and we do anticipate that it will increase, particularly in this outpatient space where having that connection virtually can get the same results as it does from an in-person experience. And then next slide, please. And last slide. And in the provider enablement space, this is a really fantastic tool. scheduling. So through our My UHC app, a member can do a provider search, but go one step further. So that access question that was earlier, how do I find someone? You can schedule online, right? This is a great step forward. It's a way that people can click and connect. The other great thing about having an online ability like this, having a virtual scheduler, is that sometimes in our mental health space, we're likely to avert care. We're likely to sometimes say, oh, I don't need it, I don't need it. So if you call on the phone and you don't get an answer, you're waiting for a call back, that might fall off. It might become deprioritized. And this is a great way to ensure that when people are raising their hands, they're able to connect to and get the care that they want and that they need. I have just gone through, I feel like an entire year's worth of innovation quite quickly. So I just want to pause here, kind of come back to that opening intention and open the chat, or if you would like to unmute, I'd be happy to take any questions.
Sure. Thank you, Heather. One of the questions that came up while you were talking was, talking about family care and mental health and kind of child and parent, caregivers. When folks are making calls and kind of outreach, is that generally a part of the service that is part of what happens?
So is helping support people who are caring for either older parents or children.
Yes.
So, sir, I mean, that could be. So, what are we managing, right? The stress, is it the stress, the anxiety, the overwhelm, all of the feelings? That's certainly something that a provider would engage with a member on. Also with the Sanvello app and the cognitive behavioral therapy, CBT, cognitive behavioral therapy, is a great tool, especially when we have a task, right? So we have something that we need to do, whether that's caring for our own chronic condition, caring for a parent, caring for a child, all of those pieces. And that helps separate those thoughts, feelings, and actions, and really give people the support and the structure to kind of manage all of the things that are coming up as they're tending to the other things that they need to tend to.
Terrific. We did have one a kind of interesting question is when you're looking at the application, somebody was wondering what is the actual application that this appointment setting is on. I've never seen that type of an appointment setting application, but is that something unique to United Healthcare, or is there other folks that are out there?
This is part of our ecosystem. So this particular screenshot is from the My UHC, and this is a new innovation that we've brought forward this year.
Excellent.
I believe there's some other scheduling tools and applications that are available out there. I don't know how other necessary payer organizations are using them, but this is the one that we brought forward to enable our members.
Yeah, I mean, so is it, I think there's a lot of questions. I mean, I think the one question that kind of seeing a little bit of a trend on, and I tend to agree with this, is because we've done some work at Health Action Council on generational studies, right? So as you think about logging in and clicking buttons and getting comfortable with technology, is it, do you have positive satisfactions about how people think about the My UHC and signing up for these applications? Because I think that's an interesting comment, kind of coming in saying, hey, if someone has a lot of anxiety and then they're trying to figure out how to schedule an appointment, are we possibly doing more harm than good through this application process?
That's a great question. I think the generation component certainly plays a part in that. I think if you look to Gen Z, they really look for everything virtual. Truly, I mean, and even some colleges and academic institutions are enabling everything through applications, whether it be iPad, iPhone, Google, Android. I think that in the, as the daughter of a 90-year-old, I can say yes, it's a little bit more challenging. But again, it's a skill build, right? So if we think about the behavior change continuum, we know that. So clicking and booking an appointment online is going to get you that appointment and you're locked in. Compared with if you're engaging in a game of phone tag, or you're trying to, you're calling, you're looking, you're searching. This is a little bit of it should be, it's designed to be a clearer path to care. And again, I think for people who are not as engaged in technology, it comes down to that awareness, like why, okay, oh, this is a better way for me to engage. This is a way I'm going to get my needs met faster. Then there's some skill building. So that's where those of us in that sandwich generation might have to do a little coaching. And then, or also conversely, the other piece that we offer is, there's always an 800 number on the back of your ID card. You can call, and advocates will walk through this with people if they don't have family members who would be able to do that. And then that sort of becomes a maintenance of, oh, this is how I do it. And then it becomes the new normal. So I think that would be an approach to take if, if you're trying to, if there's people in your own life individually, if that's where that question came from, help. It's tough to move everybody into, you just schedule everything online all the time, right? This is the best way to get to your schedule. Here's how you do it. Let's practice. And then it becomes an independent piece.
Perfect, Heather. I want to thank you tremendously. I for one, being the host of this and having that last minute technology snafu, when you brought my blood pressure down by about 20 or 30 points when you had me take a deep breath. So thank you for that. And so as we move on, when we talk about the next steps, because the questions are done specific to that side, what I want to do is maybe introduce the rest of the folks, kind of what Health Action Council is doing in this space and some of the stuff that we've done, because I think one of the questions that we've talked about some insights, reboarding and how do you get people back to work. We've done reboarding too, which is understanding how the brain works. We're not going to be nearly as smart as Heather or have her knowledge and capabilities, but when you understand how it works, and then you can take about practical steps that you can do. All of these resources are available on our website. We do other things like informational webinars about the past of these items. And then, we did Medication Matters. I would also tell you that's not here, but as I was thinking as you were talking, Heather, was this whole idea about social stigma. And the idea, because when we study our data as a partner of United Healthcare with 300,000 plus lives covered with you guys, what we found is that the younger generation, that millennial and Gen Zs, they spend a lot of time, they're comfortable with mental health providers. As you get older, into the Gen Xers and older, myself, whether we want to call it the sandwich generation or that older folks, they're just not as comfortable dealing with mental health providers. So, the virtual visits might be a wonderful way for folks to take advantage of that. But when we look at our data, again, we feel very comfortable that most of the expense that's going right now into those younger generations, is actually, we're finding that mental health and is leading the cause in that space. So when we think about the things that we do as an organization, what Health Action Council focuses in on is understanding where it fits in all of those directions. For those of you who may be looking for additional resources, one of the things that Health Action Council that we like to do is procure content, and ultimately what we're looking to and identify is here's some additional resources that for people to understand, right? Because I always like to say, talk about scheduling the appointment and the anxiety of getting that done. If I'm a patient searching for mental health near me or mental health help, and I go to my favorite search engine and I type it in, odds are I'm going to get 500,000 or more results in less than a half a second. It can become overwhelming. And the right resource for me may not be on the first page or the second page based upon how they're indexing things. So it's a challenge. So what we at Health Action Council do is try to bring resources and help people make better decisions and make it easier on them as you're doing your job. So again, more resources for you to think about and where that's at. Big picture about who Health Action Council is. We do really three things: education, group purchasing, and health improvement activities. Just kind of a quick overview of our virtual conference series this year. Whereas I appreciate the phrase, the new normal, I like to call it the next normal because because if this is the new normal, I think a lot of people are going to struggle with it. So there's going to be something else that comes after the pandemic. And then we're going to be dealing with another round of changes, whether it's more technology advances or more mental health issues. And that's really when we thought about this and we wanted to put this together to educate people and get them thinking differently. That's part of what we do at our conference as well. So for those of you interested in looking at our conference, just a quick overview. Here's some of the topics. Our member companies have said this is what's important to us. Right there, you can see mental health and mental and behavioral health is right at the top. Social determinants of employment and health. These are key issues that folks are looking at that we've got wonderful speakers coming in on. And again, it's part of what we do as a member-driven organization. Education, again, that's our conference series is part of our education. We're going to go through that, teach you what you're doing there. All of that comes with Sherman HRCI credits. So it adds value to our folks who are taking advantage of that. Our health improvement activities, again, this is our DNA. I mean, we're a nonprofit organization that started in 1983. So Leapfrog is a hospital safety. We firmly believe in health literacy and continuing to teach people and create awareness. So we've got the Leapfrog, which is hospitalsafetyscrades.org. Find the Right Care is a website that it's free to everybody. Findtherightcare.org. It has an artificial intelligence symptom checker on there to help people out. And then we promote, kind of creating healthy activities through Step It Up campaigns and our Healthy Kids campaign, which is to deal with our future workforce. How do we get immunizations are way down as a result of COVID? They were way down heading into COVID, but it only got exacerbated as a result of that. Our point is we don't want measles, mumps, rubella, all of that coming back, chickenpox as a result of COVID. So remind yourselves and your employees and everybody to get out there, get their vaccinations and continue to keep up to that with what's going on. And we also want to build our next, so the people who are in high school today or junior high, that's your future workforce. We want them to become better healthcare consumers and develop better primary care practices so they can, as they mature and start to work for you, have better habits to help manage your plan costs in the future. For those of you, we do group purchasing programs. Again, it's all about saving money. And then again, going back to our DNA, improving health outcomes. We really, kind of take those programs, put you and your advisors in control of that with ultimately the value that comes out of that. And you guys manage that. Here's just a quick overview of our endorsed vendors. We work with United Health and UMR, IMED and VSP, CVS and Optum. We've done successful years, and then for flu shots with Wellness Corporate Solutions / LabCorp. All of that information is available on our website, healthactioncouncil.org/group purchasing. You can find all of the information that you need there. I think it's, as far as continuing the conversation as we wrap up, and we thank everybody for their time. If there's any questions that people have or they want to put into the chat box, please feel free to do so. Please sign up for the monthly newsletter. You can email us. Happy to reach out and have conversations with everybody and visit our website. Before we close and people start heading off, Heather, I cannot thank you enough for taking the time to talk with us. Share your thoughts and insights as to your professional opinion, as well as what United and Optum are doing for members. If there's any additional questions from the folks that are out there, I would certainly please feel free to type them into the chat box, and we'll make sure that everyone gets a copy of this as we go on.
Thank you so much for having us today, and certainly, I wish everyone well. This is hard, but we can do hard things, and we'll work together.
All right, thanks, Heather. Thank everybody else for joining us. We will make this available to everybody. I've got a couple requests for copies of the presentation and information that's coming on. We'll continue to share this to everybody. And again, thanks everybody. And we look forward to the next opportunity to talk.